Mamas, is your baby breastfed? If they are, I want to talk to you about some of the common complaints that bring breastfed babies to the emergency room. Hi, I'm Gwen, a pediatric emergency nurse and mom of two. The common complaint that we're going to talk about today is infants vomiting blood. Now, I know that sounds really scary, but in this instant, it's very harmless to your baby. So babies that are breastfed, typically this happens in the older baby that has teeth, but can happen to baby at any age. If mom has a cracked nipple, which is a bunch of little cuts around the nipple, you probably know because it really, really hurts. But just like with any other cut all over our body, it does bleed a little bit. So when a baby's sucking on that nipple, they're also sucking a little bit of blood out. Then when they swallow that blood, it mixes in their stomach, and it is a known irritant to the stomach, so that's what causes the baby to vomit that blood up. So it's not that they have a bleed, it's just that they swallowed a little bit of blood. Again, this is not harmful to your baby in this instance. So the things to look for if this happens to your baby is that they're looking well, that it was only a small amount of blood, less than a quarter size. And oftentimes it's kind of stringy and clotted when they do spit it up. If you notice these things, you can call your pediatrician, and as you're on the phone with them, try to start pumping. Once you get a hold of the triage nurse, you can say that my baby spit up a little bit of blood, but they're looking well. And I did pump and my milk was kind of pink. That hopefully will be reassuring to your child. When babies with this come into the emergency room, the first thing I do after speaking with the parents is give mom a pump to be able to pump, because lots of times I know residents see the chief complaint of vomiting blood and they put in a ton of labs to make sure nothing bad is happening. But if we can confirm the source and know that the source isn't from the baby before that, it really can prevent those sticks and blood draws and workup that might be unnecessary in this case. If this happens to your baby and they're looking well, they only vomit a little bit, and you know you have a cracked nipple, I hope this can reassure you that your baby is going to be okay, but still call your pediatrician.